My name is Chelsea and I'm the youth coordinator for Rare Youth Revolution and I will be hosting the talk today. I'm here with Lindsay and Anna. Would you both like to introduce yourselves?
Would you like to go first or would you like?
I don't mind.
Okay, I'll go first. Hi, my name is Lindsay Green. I am a survivor of necrotizing enterocolitis, and I am a rare disease patient advocate, a writer, actress, and I work as an assistant producer in XR.
I'm Anna. I'm also a necrotising enterocolitis survivor. I was also a term baby, so very rare. And I'm a midwife in Scotland. So I work with women who are in labour, unwell, sick babies, and also sometimes babies who have NEC.
Thank you both for introducing yourselves. So the first question I'd love to ask you both is how would you describe your condition to someone who maybe hasn't heard of it before?
So I would describe necrotising enterocolitis as quite a devastating disease that can affect unwell term babies that for some reason may have got it, so from a traumatic labour and delivery or for some other reason unknown, or preterm babies are most at risk because their bowel has not quite developed yet. They're almost at a stage where they should be in the womb, so the bowel's more susceptible to infection, and it can affect babies in a way that they may need surgery or they may not need surgery. So sometimes babies can be put on antibiotics and it can heal the bowel, but sometimes it's too late and the bowel can perforate, which is what happened to me, and it requires a baby to need surgery to remove the affected portion of the bowel and sometimes to need a stoma as well. Necrotising enterocolitis can display in a few different ways as well. So babies can have quite a distended abdomen, so it becomes quite large and outwards. It's quite shiny on the skin and quite kind of solid to the touch. And most people don't really know what it is as well until it happens. A lot of the time parents kind of say, oh, what's wrong with my baby's neck? I don't understand what's happened to my baby's neck. I've not heard of this. And it's hard to get that across to people that actually your bowel can be fatal.
Exactly. And then I was also a term baby and I had surgical neck. And so often I think it's quite common for people's small bowel to be part of it to be surgically removed. So a lot of survivors of this condition have short bowel syndrome. I do not qualify as that because I had part of my colon removed actually. So it's really interesting because as I've been kind of in this space since maybe about 2017, 2018, I've met a lot of families and neck survivors who have been dealing with different kinds of long-term outcomes of this disease. And this is something that is very under-researched, not really spoken about. It doesn't even have an official name yet. I kind of compare it to long COVID in a way. We don't really have a real name. The long neck kind of doesn't work. But there's just such a big spectrum of issues that we're dealing with. Some people are nonverbal. People who are experts in the neck space were surprised that I was even able to go to university. Some of us cannot eat food orally. We have such a big spectrum of outcomes, and there's just not enough research to really understand what's going on and how we can get that care that we need when we're older.
It's really quite tough because every time you say to a doctor, they go, oh, that's a neonatal problem. That's something you see in neonatal. It doesn't matter when you're an adult, but actually it does affect your whole life. And when you think about it, me and Lindsay have never had our full bowel, like never. I had mine for 6 hours. I've had a normal bowel for 6 hours of my life. That's all I've had. And it's really hard to get that across to people because then they'll say, oh, well, at least you've had it your whole life. It's not like it happened and you've had to get used to it. But actually, it's really tough when you look back and think this happened to me at 6 hours old, and that's me. That's my life now until I die, basically.
Yeah,
and it's never going to change. A bowel transplant is not something that's feasible for people like us, and a lot of us don't actually know how much bowel's left. Like, all I know is I've not got much colon, I've not got much short bowel, so like much small bowel. So like I don't know, I keep getting told I've got plenty because I can put on weight, but realistically my transit time is 20 minutes, so there can't be much in there.
But also even just having a little bit removed, impacts a lot because a lot of people, the big misconception, I guess, is because there's so much of it, people think, you have enough left to get on with your life. But people don't realize that it's actually a really essential part of your body, and it can have an impact neurologically. It can have, an impact like in so many different parts of the way that you function. And a lot of us are discovering that as we're getting older, we're having more and more issues. So I had small enough issues when I was a small child that my family were kind of able to ignore them. But then when I was 16, I had to go to the hospital and I was just in a ton of pain. And it was the first time that I thought I was convinced I was going to die, because the doctors just could not figure out what was going on with me. And then later on, they realized, oh, this is long-term complications of NEC. But then they did not know what to do. They didn't know what to do about it. And I can't get long-term care because gastroenterologists are like, well, there's no research, so there's nothing we can do about it. So it's, it's quite concerning. And I think Anna and I had some meetings a couple times last year with some other adult survivors of this disease. And the one big thing that we just kept, saying was, we have absolutely no idea what's next. We're always wondering, what now? What's going to happen in the future?
Both of you mentioned the term baby, and I just wanted to ask if you could kind of explain that a little bit more and elaborate what that actually means for you both.
Right. So a premature baby is a baby born before 37 weeks gestation. They are categorized differently. So a micropremi is under 28 weeks of gestation, and they're affected mostly because, of course, they've come so early, rather than coming between the weeks of 37 and 42. So me and Lindsay were both born after that 37-week gestation period, and it's much more rare for a baby to get NEC in that time because our bowels have developed at the rate that they should do, whereas a preterm baby, their gut is so underdeveloped that even things like feeding bacteria will get through to the bowel can't kind of fight against that bacteria. So it's a very different reason as to why they get it. So I'm not sure the reason you got it, Lindsay, but it's likely that I got it because my mum had quite a traumatic labour. I have looked at my mum's kind of maternity notes just out of interest, and when you've trained, you do kind of like understand reasons why it might have happened, but of course this was now 24 years ago, so there's kind of no proof, but there's research as to babies becoming hypoxic in the womb. So that means the lack of oxygen has caused the bowel to be the first thing to kind of go. It's deemed the least important as a baby, so your body just kind of goes, right, we'll preserve the brain, we'll preserve the heart, we'll preserve the lungs, what can we get rid of first? And the bowel is kind of the first thing to get infected. So it's kind of different as to why babies can get it, and sometimes babies can get it for a completely unknown reason. It's just a bit of a stem of bad luck.
Yeah, in my family, we don't really know why. Because I was a term baby, and because, even just now in the discourse, we've only just now started to, remind the community to be inclusive of the fact that, it's not just preemies who get this, condition. But I remember my parents said that I was low birth weight. So I was quite small for a term baby. And as soon as I was born, I had all these different issues. I had a heart murmur. I was sent straight to NICU. And so when my parents are sitting there waiting to, for me to be brought back after they're checking my vitals, and they're wondering, where's my baby? And they weren't even allowed to go inside the same room as me. They had to watch me through a window. And then a few days later, they were finally able to go in there, but wearing PPE and everything. And just from the very beginning, I was never able to hold down my mother's milk. And when they realized I just was not digesting anything, that's when they started doing some tests, and I was diagnosed with NEC. And I was really grateful that I was in a small hospital where it was quite slow, and where they were able to then, spend more time and pay more attention to the babies there, as opposed to the, more popular hospitals where I come from, because otherwise they said that they might not have caught it as soon as they did.
It's really interesting as well because were you born in America? I feel So obviously,
I live in London now, but I was born in Georgia.
Because obviously I was born here, but our stories are like in a way so similar, although it's different because I feel like maybe yours is more because there's ongoing other medical things, because a more ill baby is more susceptible to getting NEC, whereas I think mine was more the hypoxia event from kind of a not so great delivery. But like it's amazing that there's two term people of a very similar age, and we've both come through kind of very similar things but in different countries and our own little way in life, but we've had the same kind of incident almost at birth.
Exactly. But look, we're making it work.
Exactly.
Work out here.
How does living with NEC affect your daily life?
I think this is where we're slightly different, I think. I I started to have more issues, I think, in my daily life as I got older. So when I was a child, I was not able to, and still today, like I cannot eat certain foods or foods that are very high in fat. The older that I've gotten, I can no longer have donuts, no longer can have chips, or for the Americans, it's French fries, like hot dogs. And then if I eat kind of like a normal amount of food at once, then I'll get really sick. So I had to have small meals throughout the day, which was quite difficult, especially growing up. And then also just missing some of my growth milestones. Being underweight kind of as a child, I felt a little bit worried, because as a child, you see the chart the doctor has about what's normal and what you should be achieving. And as a child, your goal in life is to grow and to grow well. And I felt like, oh no, I'm missing it. But I think the helpful thing that my doctor told me was, you had a very different start to life. You had a rare disease. You are just different. So don't compare yourself to other people. And I think whenever I had difficulties just with different kinds of symptoms, I think I just would remember that and just tell myself, okay, but I'm different because I had a different start. So I cannot be kind of compared in that same kind of way to everyone else. But I think one thing that my family definitely did not pay attention to, and we probably should have, was that every so often I would wake up and I would be in a ball and I'd complain that my scar hurt. And I felt like I was being sliced open like a turkey for Christmas dinner. And we just, never did anything about it. And then one day when I was 16, that was when I had to go to the hospital. So after that, I was in pain almost every single day of my life ever since then. And I realized that in order to kind of exist in this world and in order to get the things that I want in life, which is the same as anybody else, I had to kind of put up with it. And that was quite hard. It was really hard to explain to teachers and to, doctors and other people in my life about, my making accommodations and certain needs that I had, because it's really hard to advocate for yourself when you don't have a name for your condition. And then the last thing, I guess, is that, like, neurologically speaking, I had really poor gross motor skills. So when I was in school, I was always very bad at sports, to the point in which my PE teacher asked my mom if I was actually left-handed, and they were genuinely concerned about me. But I became more of an arts kid. And now about a year ago, I was diagnosed with functional neurological disorder, which basically means that my brain signals don't work properly. And my neurologist said that, he suspects that was probably because I had such a traumatic start to life. So yeah, it's been interesting.
I feel like I can like some of the things I can relate with so much. I feel like I've been a bit different in a way because I don't know, I feel like I've not had huge struggles based on just the neck. It's all the after stuff. And because you get so used to living in this way, you kind of like, oh, it's fine, it's my life. Like, you don't actually realize what you put up with every day. And I think it's so easy for normal, I say normal, like no one's normal, but it is so easy for normal people to take for granted what they do in a day compared to what we maybe have to do in a day. So when I was born, I had a stoma placed to kind of, just because I had so much bowel removed, it was seen as the only way that I'd survive. I had that stoma until I was 13 years of age, so that's a particularly long time for a baby with NEC. Usually you'd get it reversed within 6 months or kind of whenever they want to. But I only got mine reversed out of me demanding it because I was a teenager who did not want a stoma. So for 10 years then I didn't have a stoma, and then I got it back in September. So I'm nearly a year now with another stoma. But like, it affected me so much because I've got such little bowel left. I was going to the toilet like 25 times a day, but I was still at uni, I was still at school. Like, somehow I was doing things like summer camps, but I'd go and open my bowels 25 times a day. And actually it baffles me now how I did that. Like, I genuinely don't understand how I managed to do that, and nobody noticed I was doing that as well. Like, nobody ever even questioned it. And it's the same as you said, kind of like trying to find a way to get teachers to make accommodations when you can't even explain what your disease is, or like why it still affects you. Like, people are just like, but you were sick as a baby, like why does it affect you? But my bowel's not going to grow back, like it's never coming back. So it affected me a lot in school. I found school particularly challenging. It's a place where you get bullied anyway, never mind if your tummy's making noises, or you accidentally have a bag leak, or people are questioning you because you're going off sick all the time. And like toilet passes, I can't believe people can't just go to the toilet.
My gosh,
And
yes, you get in trouble.
You
got I got in trouble. Did you get in trouble?
Well, I managed to get away with it because my mum obviously just stormed into school. I think it was maybe also different a little bit here. Like I feel like they're a bit less strict on it, I guess.
Even at uni, at American unis, I get in trouble after sending articles to my teachers.
It's honestly awful. Like I don't think anyone should be told not to go to the toilet, never mind someone who has to go 25 times a day. And if I'm not going, it's coming out anyway. So it's best if they let me go to the toilet. Like that's the reality of it. And like even stuff kind of like if I needed the toilet twice in a lesson, everyone's going to question that and be like, well, what's going on? But your body kind of just does things at the pace it's going to do it. I'm rambling on again, but it's just coming out as it's coming out.
It's okay. I mean, one of the questions later is actually on school life, so we can touch on it again in like a little bit. But yeah, I mean, I think the other thing is for people that don't have rare conditions, even just girls needing to, they have their period.
Yeah.
Even that, people shouldn't be stopping them from going to the toilet if they need to go. Or I mean, nobody should be stopped anyway. But just for simple things like that, people still make such a big deal out of. It's insane.
Do like another thing as well, like with growing up with a rare disease, or even like the outcome of any illness, I always think, so a normal person, a normal girl, they have periods, they have fertility problems, they have children, they have to make their dinner, they have to get dressed in the morning, they go to the toilet, they go for a shower, they drive a car. But then we have to deal with pain on top of this, we have to deal with fatigue on top of this, we have to deal with like indigestion on top of this. Like I'm pretty certain I maybe have some neurological problems from birth. I'm pretty certain I must have had something, but nothing's ever been diagnosed. And I always feel a bit like I don't fit in at work, and I just feel like there's so much else in life to deal with, and then we have this extra kind of chunk of stuff, but we still are expected to hit this same stuff as any other person would. So it's really hard to get across to people that yes, driving to work, it's not a big deal, but actually it's a huge amount of energy and stress, and like it's just so different for us, I feel. I've not explained that very well, but I feel like you kind of understand it.
No, because this is exactly what you articulated. I've had moments where I'll just sit there and just be upset and just be like, why, why is it that, because we didn't do anything wrong, right? Like a doctor once said, I'm going to diagnose you with bad luck, okay? Like this is bad luck. And, a lot of the problems that I've had, I mean, we've done a pretty good job of, as you said, like adapting, at some point you kind of, it is your normal. It is your normal. But a lot of it then just becomes, I think, society and, it's the people in our lives that sometimes can make things harder for us. And so on top of all those different things, like at the very least, it's not that hard to accommodate people who have some kind of disability or some kind of illness. It's not that hard. So if they could just let us use the toilet or let us do whatever we need to do.
I feel like they just don't make space for our struggles almost. It's like, yes, you're tired, but what can we do? Like, this is your job. You chose to come to this job. You know that this job is going to make you more tired. So why don't you just pick a different job? But it's not like, I know that midwifery 12-hour shifts are hard. I understand that. Like, I know that anyone's going to be tired, but it's very different when you live with chronic fatigue and then do that. And it's not that I could just get another job, because I love midwifery. Like I absolutely love midwifery. So why would I want to get another job? I'd rather kind of take the struggle.
You're good at it. And not only that, but I think there's something really special about, especially if there's a family that has a baby with NEC, have someone actually show up who's doing, as well as you are, and to actually meet the face of hope. There's something that you can give. That's someone who's never experienced that personally, or people who work in the medical field who only see us as science and not as people. There's something very special that you're able to give people. And I think that sometimes people are so hung up on, the fact that you may be a little bit more tired than the average person sometimes, that they completely overlook the fact that, yes, there are certain kinds of drawbacks that we may have or certain difficulties, but people who have, especially rare disease patients, there's something about our insight and our perspective that I think is so valuable that most people never understand. And I think that's such an asset.
Okay, so I'm gonna move on to the next question now. So, how does your condition affect your family life?
So I think this needs a bit of context. So I'm the only child. My parents had me a bit later in life, and it was difficult to even have just me as the one. And after they had me, they were advised to, not try to have any more children because it might lead to something that was quite tragic. So when you have only one child, that child almost passed away, and you see that child, I guess, in a very fragile way. So when I was a baby, my parents would put me in the center of the table when they were eating and watch me like a fish in a bowl, just constantly watching me. And they were very protective. And I think it wasn't really until I was speaking at my first NEC symposium, and my mom came up to the microphone and started crying when she was sharing her experience, that I realized that my parents weren't just being like, oh gosh, why are they being so protective? It was because my parents were traumatized. And I think I did not understand that until I was about 21 years old. And I think it made me realize that I did need to give them that space to feel what they needed to feel. And I think I became a lot more understanding as I began to understand just how much of an impact that has had. I think as someone who has multiple conditions, I've noticed that it kind of maybe a bit re-traumatizing for them when I get a new diagnosis. And it may be a bit difficult for their daughter to become even sicker than she was before. Or my mom will sometimes wonder every single time I get a new diagnosis, she'll say, I wonder if there's, something that, I might have done wrong when you had NEC, or I wonder if, I let them give you too many medications, or, I'm scared, if we let you have this MRI, if they give you contrast, like you had so many things done as a baby, like what if this, makes you even sicker? So there is this, I think, fear of me getting worse. So it's really important for my mother, especially when she comes to visit me in the UK and she sees me, working away and, my job and, still, having friends and living my life. I think that kind of offers her this sense of reassurance that even though I'm a disabled person, and even if there's new challenges thrown my way, she sees how I keep moving forward. But I think there is that kind of anxiety in my family for sure. That's kind of a big part of our history together as a unit.
I think like with kind of parents and family and extended family members, like it's not what anyone obviously had planned for their newborn baby. Like nobody thinks, you know what, right, this might happen to my child. I might end up stuck in the neonatal unit for a year. And because I didn't get discharged until just before my first birthday. So my whole first year was spent in a hospital. Like all my Christmas photos were in hospital, all my first bath was in hospital. I had 2 baptisms just in case. Like everything was done in a hospital, and it was all just in case. So a lot of things were done as an emergency, and it was almost like it must have been so hard for them. And I was also the first child as well, so like imagine wanting that like beautiful moment with your child, and then they just get whisked away to the pediatric hospital about half an hour away in an ambulance, and you just don't know what's going on. You can't get there for a few days because you're recovering from giving birth, and like it is absolutely traumatizing for the family. And I think also as a survivor of a rare condition or someone who's grown up, you find it really hard to kind of see that impact on your family, because you're like, well, it happened to me though. Like it's so annoying that they're the ones that are like, for years and years I was like, why are you so bothered? Because it doesn't affect you. But actually, like when you grow up, you start to see how that does affect them, and probably actually more than it does me now, because I'm like, oh well, it's done, this is me, this is what I'm dealing with. But they obviously like have watched everything happen. But another thing as well is obviously with us being in the neonatal unit, a lot of things like bonding, I feel have been very different for children who have started off in an incubator. Like I know that like my parents love me, I love my parents, but I know the bond is very different to maybe a family that could have cuddles every single day, and we're feeding straight away, we're not behind a piece of plastic basically for months and months on end. And I was like in and out of theatre kind of the first week of my birth. I was getting TPN lines, I was getting like my stoma, and then my stoma got recited, and like everything was done with the help of a nurse. They could never do things just themselves because I was like intubated, I had ventilation on, I always needed oxygen. So it's really hard like to kind of look back and sort of see the pictures and think, oh, that was kind of how things started, and you can understand how family dynamics are kind of developed from there, I guess.
For sure. My dad still can't talk about necrotizing enterocolitis. Like I tried talking about it with my family a couple years ago when I was trying to write a story for my creative writing class, and my dad got up and left the room because he still can't talk about it, and I had no idea that he was still affected that way.
I think my dad was hit particularly hard as well. I think the dads are often the ones that get left. Like there's so like, and of course there's so much focus on the mums, like they're giving birth at all this, but there's so much that the father gets left out of. They're just kind of like left to sat there. They're expected to look after the mum while whatever's happening. No one really kind of looks at their mental health and how they've been affected. It's definitely changed recently, but I think back then, like my dad has probably completely changed from it. But going back to kind of like how the family dynamics have been kind of throughout life, like I think I've been particularly lucky that my mum has not been hugely like anxious around me. Like I know parents often are very kind of overbearing, especially when you're growing up ill and stuff, but I think my mum just got so used to being left to her own devices that she just had to kind of, like both my parents actually, like they both had to just learn to cope with this version of a human being almost. And things like, I think they just learned to, even though the doctors said, oh, do this, do that, they kind of adapted it so that it suited us. And there was a day like she just took my Mickey button out, like my peg tube, because she was like, well, she's eaten and it's infected, so I'm just going to take it out because there's no point in going to A&E. So basically my mum just made the decision that I was finished tube feeding and I'm fine. So I feel like we're maybe a little bit different in that way, that she doesn't kind of panic over me, or like she's not anxious over me. Like she probably is, but she just doesn't show it. And she's just kind of like left me to my own devices as I've grown up. And almost like whenever something happens to me, she's like, oh, you're fine, you've been through worse than this. And I don't know, she probably panics internally, but it just doesn't come out.
Does it teach you a lot about, I think, acceptance, looking at the way that you handle things and then the way that you're different, different people in your life handle what you're going through? Because I think for me, like it taught me a lot about, I have some people in my family and it's denial, right? Like denial is the way that they handle things. For some people, it's very much like a panic. I've noticed for me, if I'm in the hospital with an emergency and I'm being told that there's something that might be life-threatening happening, I'm just cracking jokes. I start cracking a bunch of really like morbid, like sick people humor. So it's taught me, I think, a lot about the ways in which each person in my life handles me and handles me and what's happening in my life. But it's also, I think, helping me to kind of be a bit more understanding and patient with them. Because as you were saying, sometimes I would kind of be like, it's my body. Like, if I'm fine, why aren't you fine?
Yeah. Mm-hmm. Everyone has like a very different tolerance level. And my family, I feel, I don't know the full kind of extent of things, but they have had a lot of difficulty with like conception. And kind of like my auntie lost a set of twins the kind of 2 years before I was born. So that you can sort of see, like they were in the neonatal unit and they both passed away, unfortunately. And so you can kind of see how like that had happened. And then 2 years later, I was put in, like she couldn't even face looking at pictures. So I think when you've had an event quite similar in its own little way, and then for this to happen, like you can only assume the worst. You can't think like, oh, they'll be fine. And especially when doctors are coming to you and saying like, oh, she'll have no chance at life, because this is a thing with NEC as well. Like they are so negative towards the babies. I've worked on a neonatal unit when a nurse literally said in front of me, oh, that child, that they'll do nothing in life. They'll just be on TPN their whole life and she'll never be able to do anything. And I was like, she's the same as me. I am here working in this same neonatal unit. I was on TPN. I have a stoma. She was on TPN and had a stoma. I was like, I don't understand how you can say that when she's like maybe 2 months old. Like give them a chance. They need a chance. And then although outcomes are very different, there's a whole different spectrum. It's so bad to be so negative, because poor parents are just going to be looking at the worst case scenario every time something happens. They're just going to be panicking, and we see it a lot in kind of like the groups that we're in, like on Facebook, like there's question after question off the same parents concerned about this and this. And I think it's just the doctors put the fear into them, and I'm not surprised they're all traumatized, to be honest.
No, I mean, I remember the first time, because I guess I've been hearing it kind of through the parents' anxiety and like the questions that they've had for me. And I remember the very first time that I met other people who've been impacted by the disease, there was this woman who looked at me like I was a ghost. And I was 21 at the time. And she's like, but you're 21 and you had NEC. And I said, yeah. And she said, well, I lost my baby to NEC, but the doctors told me that if she had survived, she would have died by 15 anyway. And I have met some parents who, you know, tragically have lost their NEC survivors to long-term complications as teenagers. It has happened, but it's not what I've heard from most of these families. I've heard a lot of families as well who, you know, are saying, you know, the doctors say that there's no real future for my kid, or, you know, like they'll always be struggling there. You know, there's nothing they can really hope for, because they can't, you know, they might not be able to play sports or whatever it is. And I just talk to them and I'd say, okay, but what are the things that you see your child enjoying? Their child loves to sing. I said, okay, so encourage your child to then, you know, sing in a choir, like encourage them to lean into those things that are their strengths and focus on those strengths, because it's not over. It's not over for them. You just have to kind of work around those challenges and figure out what you can do with the crayons that you have left in your, you know, Crayola box. You can finish the picture just differently.